This week, we're bringing you the inside story on access to mental health care. Behavioral health experts say services are in high demand, but aren't easily accessible. In a 5-part series, we're looking into the challenges people on Medicaid and Medicare face when getting help. News 8's Leah Hodges is live this morning to explain. Good morning.
Hey, Drew. Well, we have received, or hospitals, I should say, have received an alarming number of calls for help, in large part due to the COVID-19 pandemic. Living life with a mental illness can be very challenging. I would say that it can impact relationships with family and friends, including physical health. 988,000 adults in Indiana have a mental health condition. That's more than 4 times the population of Fort Wayne. These conditions range from anxiety and depression to prescription drug abuse and thoughts of suicide.
Anxiety and depression becoming more prevalent and more obvious to us. The last thing we want is for anybody to not get the help they need.
Covering Kids and Families of Indiana is a navigator to help people obtain health insurance. Medicare enrollment in Indiana stood at 1,277,996 people in 2020.
Medicare is something that's usually for adults who are 65 plus or some of those with certain disabilities.
But Medicaid is the largest public funder for health care in the nation, with more than 1,695,000 Hoosiers enrolled.
Which is traditionally for very, very low income individuals, but also for women who are pregnant and children. They have a little bit easier access to that program.
Why is it challenging to receive care with so many people on Medicaid? Well, the insurance isn't easy to apply for.
It's easier to qualify for Medicare because traditionally, if you're in that 65 plus category, you're in. There's not income checks and balances and all the other things that you have to do with Medicaid that make it a lot more difficult to not just get it, but keep it.
Although people with Medicaid don't pay out of pocket to receive care, there aren't many healthcare providers who accept Medicaid because of low reimbursement rates, meaning Medicaid doesn't pay for the full cost of service to the provider.
So the provider is basically saying, I'll accept Medicaid patients. I know I'm going to make less on it, and I'm going to hope I can offset that elsewhere because I want to serve them, I want to provide the service, but I'm going to get a lower rate than I probably am from somebody paying on their own or from some private insurance.
And next, hear from a local man who has been searching nonstop for a provider that accepts Medicaid and Medicare, and he never gave up. That's tomorrow in part 2 of this series.
Behavioral health experts say mental health services are in high demand, but those services aren't always easy to find, especially for people on Medicare and Medicaid.
An Indianapolis man says he's been searching for weeks to find help. News 8's Leah Hodges is here with today's Inside Story. Good morning, Aaliyah.
Good morning. His name is Brian Stone. He's a recipient of Medicaid and Medicare, but he felt like his cry for help fell on deaf ears and was left in a dark place. In part 2 of this series, you'll see what all he had to go through just to receive care. Brian Stone has been on disability since 2014. He got injured while running his own tile company. To add even more challenges, Stone lost his sister in 2017 and his mother shortly after.
It's just been a mental, depressing thing.
So Stone picked up the phone, hoping a mental health care provider would take his insurance.
When you call the insurance company, you feel that they're going to be the ones to direct you in the right direction.
But he discovered no one accepted Medicare or Medicaid.
It got to the point where I was calling 4, 5 a day, and a lot of times they would say, well,
unfortunately, we are not able to take new Medicaid, Medicare, or TRICARE patients at this time.
But Stone kept dialing.
It got to the point where you didn't even want to call anymore. And I kept chugging along, and kept trying. It becomes, well, maybe suicide's a better thing than trying to seek help because it's easier.
Until someone answered with open arms. 33 days later, Life Recovery Center took him in.
I called in tears and pretty much begged them, and they said that they don't get phone calls like that every day. So they took it upon themselves to help me.
Since May, Brian Stone does individual therapy in the morning and a group session in the evening once a week.
It's got my depression to a state that is manageable, and I feel a little happy, really. And so it's really helped me a lot. To the people that feel the need to give up, I say don't, because there is help out there.
I spoke with Brian a few days before the story aired. He is continuing treatment at Life Recovery and says he's taking it one day at a time. Coming up tomorrow, hear from facilities that primarily see people with Medicare and/or Medicaid, and they don't turn anyone away. I'm Aaliyah Hodges for Wish TV, wishtv.com, and follow us on Facebook.
Health insurance is a critical determinant of access to health care, but not everyone can afford it. In fact, millions of Hoosiers are either on Medicaid or Medicare, and some of those insurances are not always accepted.
Right, so just where can people go? News 8's Aaliyah Hodges has the answer in today's Inside Story. Good morning.
Good morning. Well, I was able to speak with a few healthcare providers who offer mental health and substance use services that primarily see Medicare and/or Medicaid patients, including a statewide council aiming to restore hope despite the challenges staff members face too. 24 hours a day, 7 days a week, Valley Vista serves patients as young as 10 years old with addiction treatment and psychiatric care. It has inpatient and outpatient services, hospitalization programs, including a residential program for girls. There's also the Indiana Council of Community Mental Health Centers. It has 24 certified locations serving all 92 counties. Valley Oaks Health helps more than 9,000 patients a year in Lafayette and surrounding rural areas.
So we connect at schools, we'll connect at the homeless shelter, we'll connect at the jails, we'll connect at people's homes, and then we can also do office-based services.
Aspire Indiana Health is another mental health center within the council. It focuses on whole health by providing housing, employment services, and primary health care for patients with underlying health conditions.
If you cannot separate someone's mental health issue from everything else that's going on in their life, employment, housing, their medical care, all of that has to go together.
With inpatient intake going up and crisis calls surging, providers who accept Medicaid say they're overwhelmed.
In order to get people into services, it's very cumbersome. Sometimes I feel like it's cumbersome so that less people have access to service because it can be so administrative burden. So it's very challenging. However, it's also very rewarding.
Low reimbursement rates from Medicaid are set by the state, and that can create pitfalls affecting daily operations and the ability to hire staff.
Let's say for me to provide an hour worth of therapy, it costs $100 today. And Medicaid reimburses, let's say, $30. These are made up numbers. Not-for-profit community mental health center has to figure out a way to cover that gap. We do contract with the state. We may have to write for grants. We may have to do fundraising. So you have to cover that gap.
And according to the National Alliance on Mental Illness, 1 American dies by suicide every 12 minutes. Hear what IU Health is doing to mitigate it tomorrow in part 4 of this series.
1 person dies of suicide every 8 hours in our state of Indiana, according to IU Health.
Yeah, the hospital network is rolling out a $1 million initiative to curb that rate. News 8's Aaliyah Hodges has more in today's Inside Story.
IU Health says the suicide rate has increased by 35% since 2001. They received a grant from the Federal Substance Abuse and Mental Health Services Administration to implement the Zero Suicide Initiative. The Zero Suicide Initiative is now implemented at all 15 hospitals within IU Health. This allows not only behavioral health experts, but emergency departments and primary care doctors to screen for suicidal risk. Everyone working together to prevent suicide.
It is the #1 cause of death in 18 to 25-year-olds and the second highest cause of death in children from 10 to 18.
Healthcare professionals will use evidence-based models with a high success rate of minimizing suicidal thoughts. It starts by asking a series of questions.
For example, are there times that you wish you wouldn't wake up in the morning? The second question that goes on from that are, have you wished you were dead? And then it goes on from, have you actually thought about ending your life? Have you made plans of ending your life? Have you tried to end your life in the past?
It also includes enhanced support services for people who screen high for suicide, like Caring Contacts. It's a text messaging service that provides discharged patients with encouraging messages and follow-up communication. Therapists and ER doctors will also collaborate on a safety plan if suicidal thoughts reappear for discharged patients. It'll provide therapy sessions until patients are able to access long-term outpatient behavioral health services.
Everyone in the healthcare system needs to be educated about suicide, how to screen for it, what to do if you identify, and how to sort of judge if a person needs immediate care or if we can assist them getting into gradual care.
The Zero Suicide Initiative will be a phased-in approach, as there will be training, new technology, and therapists. Also, ways to educate people beyond the healthcare system.
If we can educate the public about how to identify people that might be thinking of suicide and how to get them into treatment, actually that can save more lives than CPR.
Between the high demand for mental health services and the bureaucracy between Medicare and Medicaid, how can the state of Indiana better fund health care and make it accessible for all? That's tomorrow in the last part of this series. Reporting, I'm Aaliyah Hodges for Wish TV, wishtv.com, and follow us on Facebook.
New on Daybreak, Indiana lawmakers are taking action to improve access to mental health care.
They say barriers need to be knocked down, especially for those on Medicare and Medicaid. News 8's Aaliyah Hodges tells us what's being done to help in the final part of today's Inside Story.
Indiana legislators recently passed what's called the 988 law. It's a way to improve how the state responds to mental health crisis, and the first step is picking up your smartphone. The National Suicide Hotline will change from a 1-800 number to 988. Mental health crisis calls will eventually be diverted from 911 into 988 next summer.
Allows us to reform the way that we do crisis response in a coordinated, efficient, trauma-informed care way.
It's a simpler way to dial for help. Senator Michael Kreider is just one legislator to make it a reality.
The goal is to make this as streamlined as possible. When somebody calls 988, they'll get access to a trained professional that will know how to either work with them directly or refer them to somebody who will.
Something that's happening right now, the Mental Health America Wabash Valley region and its system called the Navigator. It's advocating for people who are waiting to receive mental health care.
Our software will generate a list. We will go through that list and we will call every single person, and we will take waiting lists, and we will put ourselves on a no call, no show list, and we will continue to contact and continue to inform the client until we've secured an appointment.
So where do we go from here? Behavioral health experts are fighting for the increase of reimbursements to healthcare providers.
Reimbursement for Medicaid and some services has not gone up since the 1970s.
And allowing more specialties to bill Medicare and Medicaid for services like marriage and family counselors, to name a few.
And we've been advocating to change that policy on a federal level. It's that one simple change that could be life-changing to our state and getting people access.
Especially breaking the stigma and wanting to get help. Fortunately, telehealth is beginning to help with that.
You're not driving up to a mental health center. You can get services in the privacy of your home.
And most importantly, understanding mental health is just as important as physical health.
And until people realize that mental health is a treatable disease, none of this will change.
I'm Aaliyah Hodges for Wish TV, wishtv.com, and follow us on Facebook.